one of the main surgical issues that we see here at Elite Sports Medicine is ACL injuries. So the ACL is the anterior cruciate ligament. It's the main stabilizing ligament in the knee. And when it tears, it unfortunately does not have any good potential for healing. So most young athletes that sustain an ACL tear, even if it's sort of a high-grade partial tear, will end up likely needing an ACL reconstruction. And obviously that's something that you sit down and talk about with your surgeon. It's typically diagnosed on a combination of physical exam and often imaging, which usually includes an MRI, to really look at the ACL itself and then to look at the meniscus and the other ligaments. If a patient does have an ACL tear, then again, typically if we want to get them back to sports, then we generally recommend ACL reconstruction, which is our current technique for treating this problem. Here at Elite Sports Medicine, we sort of have a wider range of approach to this issue because we treat patients who are very young, such as 9 or 10 years old. We have patients that are still growing but are getting closer to the end of puberty. And then we have our young adult and collegiate athletes who are skeletally mature. And so that's where the difference comes in with how we opt to treat things. So in general, if a patient has a lot of growing to do, so more than 2 years of growth remaining, then we have to change up our technique, and we have special ways to treat these patients that avoids their growth plates completely. The rehab is actually fairly similar to our older patients. If anything, some of our really young patients may bounce back a little bit quicker. But the technique is important to avoid any growth problems down the line. In that mid-range, so about 2 years or less remaining, we are actually able to do particular techniques that can cross the growth plate, so drilling the standard tunnels that we normally use in the adult style reconstruction, but making sure that we don't put any bone across, so that makes us sort of think about what type of graft we want to use and how we're going to place that graft, and our technique changes a little bit in those situations. And then once it comes to, again, if you're essentially done growing, then there become a lot more options as far as choosing a graft. So I think the most important thing, if your child is dealing with this, or if you're dealing with an ACL injury, is to really have that conversation about what's going to happen afterwards, because there's lots of things that go into making decisions about what type of graft you're going to use, and also sort of setting expectations for when people are going to get back to playing at the level that they want to be playing at. The surgery itself is 1 day, but the rehabilitation and the time away from sports, or the time to get back to sports, is a significant commitment.
My name is Brian Greer from Physical Therapy and Sports Medicine Centers in Glastonbury. Some things that you can expect coming into physical therapy after an ACL reconstruction. At first, we keep it very simple. We're looking at respecting that healing timeline and following a protocol from the surgeon to make sure that you can safely progress onto the different phases of this ACL post-op rehab. Moving forward, it depends on what sport you're looking to get back to. We like to keep it very specific so that if you're a soccer player, we are looking at soccer-related activities and catering exercises to make sure you can play soccer again. That's going to look different if you're a swimmer or a baseball player or a football player. Depending on what age you are, what sport you play, there's differences in the way that we move forward with physical therapy after that initial healing phase. With what we're able to do in physical therapy, we can see you very soon after surgery, but that definitely depends on what your surgeon recommends. The doctor will let you know when it's good to start physical therapy. If it's a couple days after, we're respecting that healing timeline once again and making sure that your body is healing and your knee is getting back into shape so that it can be prepared for what we're gonna do down the line. We start with some manual therapy right away so we can get your knee moving the way that it should. And over the upcoming weeks and months after that initial visit with us, we'll be doing more sport-specific exercises and strengthening procedures to make sure that your knee is strong enough and stable. And we want to promote that stability further down the line so that we can prevent another injury so that you can continue to play the sport that you want to play. In respect to healing timelines, at first, your body is working really hard to heal after the surgery. That's why there's swelling, and there's a good reason for that. And we may be starting with certain modalities to reduce that swelling and allow your knee to continue healing. But as we move forward at a certain time, we know that it's safe to really push your knee. That graft is fully healed down after a specific time period, and based on a protocol that we get from the doctor, we know, okay, now we can start to push it, bear more weight through it, bend your knee to a certain amount. There's different timelines that we follow so that we know that it's safe to do all these progressions that are going to help you get back sooner rather than later in a safe way. After we get through that initial phase of making sure you have range of motion and strength, we're going to look more into specific weight-bearing activities depending on your sport. So that could look like single leg, balance exercises, different types of jumping and landing, making sure that that stability is there, whether you're on 1 foot or 2 feet, because we know that in whatever sport you're playing or whatever you're looking to get back to doing, there's going to be times when you have those different pressures through the knee. So we're going to make sure that we can cater our exercises to the healing timeline that you're at and put different pressure that the knee can expect in real life. This is definitely a team effort throughout your whole plan of care. We're communicating with the doctors, we're communicating with you so that everybody's on the same page. We basically want to make sure that we're taking the best approach, that there's no surprises, and that we can safely get you back on the field as soon as possible, but in the best way that we know how as a team.